Trauma bonds are intense, emotional connections that form between two people within an abusive or unhealthy relationship. People who are extremely vulnerable to trauma bonds also suffered childhood abuse, which in turn created a trauma bond relationship with their own parents. Therefore, continually to live out trauma bond relationships in adulthood. Identifying the signs of trauma bonds can help individuals with the unhealthy aspects of a relationship and the potential to seek help. One common sign of trauma bonding is experienced feelings of intense love for the abuser, often coupled with a strong sense to protect or help them. Despite the harmful behavior that they exhibit, this type of attachment can lead to cycles of abuse, with the victim rationalizing and excusing the action of the abuser in order to maintain sense of love and connection. These cycles of abuse often involve manipulation, gaslighting, and lies from the abuser. This can lead to increased self-doubt and difficulty understanding one's own emotions. Victims may start to question their own memories, believing that they are at fault for their experience or that they are imagining abuse altogether. Another sign to look for is patterns of threats and positive reinforcement by the abuser. Abusers may threaten with physical harm, emotional consequences, or even breakup or abandonment to keep the victim in a state of fear and dependent on them. They also use intermittent periods of love bombing, showering the victim with affection and attention to create a sense of hope and reassurance. But this hope often reinforces the attachment to the abuser, making it difficult for the victim to break free. Symptoms of trauma bonding can manifest differently depending on the individual's attachment style and emotional regulation. Guilt, shame, and a sense of responsibility for the abuser's actions are common feelings that help maintain this bond. People with a history of insecure attachment might be more likely to form trauma bonds, as their own emotional needs and fear of abandonment intersect with the abuser's manipulative behavior. Trauma bonds can have a significant impact on the individual's mental health. The victim becomes emotionally attached to the abuser due to the intensity and unpredictability of the abuse. This can lead to a variety of adverse mental health consequences, including depression, anxiety, panic, low self-esteem. Depression is a common outcome of trauma bonding, as victims may feel trapped in this cycle of abuse and struggle to see a way out. They may also experience persistent sadness, hopelessness, and fatigue. Anxiety can also result from trauma bonds, as individuals may feel constantly on edge and fearful of their abuser's reactions. This heightened state of anxiety can lead to sleep disturbances, irritability, and difficulty concentrating. Moreover, trauma bonds can profoundly affect the individual's self-esteem. The constant presence of emotional and physical abuse can make the victim doubt their self-worth and question their ability to form a healthy relationship. Feelings of inadequacy and shame may arise, further exaggerating the mental health struggles. Post-traumatic stress disorder is another potential consequence of trauma bonding. Exposure to toxic or abusive relationships can trigger symptoms such as intrusive thoughts, avoidance of reminders of traumatic events, and negative changes in mood or cognition. In some cases, these PTSD symptoms can become disabling, severely impacting the individual's ability to function in their daily life. It is critical for individuals experiencing these effects to seek professional help and intervention to break free from the cycle of abuse and learn how to establish healthy relationships in the future. Because these relationships can be characterized by ongoing patterns of power and control inflicted by one person upon the other.